Hi, medical terms. Diagnosis: the identification of the naturalness of an illness of other problem. The examination of the symptoms. Prognosis: plural, the likely course of a medical condition, an opinion based on medical experience of the likely course of a medical condition. The disease has a poor progresses. Symptomatic mode and psychical or mental failure which regarded as indication a condition of disease particular to the patient and conditional condi- indication of the existence of something specifically of an unsafe situation. Treatment: the manner is something we have to have of days with something of something. Medical care give to patient of an illness or injury. I am recycler treatment of an injured shows. Prescription is an with leader of electronic order for an quality hygiene care products typical and doctor or are Mercer practice owner had authorized a patient to receive a specific medication treatment or therapy. Antibiotic. Antibiotics are a class of medical that are used and treat bacterial infection. They work by either killing the bacteria or inhibiting with growth. Antiviral. Antiviral are a class or medications used to treat viral infection by inhibiting the replication of virus or reducing fear symptoms. Anesthesia. Anesthesia referring to a state of temporary loss of sensation or consequence induced by medical professional of the purpose of performing medication procedures or surgery with minimal or no pain and discomfort the, of the patient. Immunization, a process by which a person becomes protected against a disease together vaccination. Each time is overused interchangeably with vaccination or inoculation. Pathology is the study of disease is an brigade weight between science and medical. It understands every space and patient care for diagnostic testing and the treatment aims to use cute age, genetic technology and prevent disgrace. Radiology as a known and diagnostic imaging is a series of tests that take pictures or images of part of the body. The field in comparison to our diagnostic radiographic and intervening radiology that both use radiology energy to diagnostic and test descent with there are several different imaging exams. Some of the most common include X-ray, MRI, ultrasound, CT scan, and PAT scan. Summary batch of medical what is con- comment with the treatment of injuries. This grade of the disorder be mouth and instrument made surger insoluble the manager of course injured and illustrated as different for chronic, slowly progressive disgrade sleep with patient with the latter type of discard most opener up. Acute. Acute. Conditions are severe and should in on onset which could describe anything for a broke bone of an asthmatic attack. PR need. Each signal is used to indicate that something should be done or take. My overnight rate had following a feature or a scooter time as mentioned about it and commonly used in medical content of the precision of medical, but it can also be seen in other contexts to indicate that something should be bone flexibility depending of the circumstance. Vital signal blood pressure, temperature, heart rate, respiration rate are measures of the body's some basic function. Therefore, my vital signal route monitor be medical professional and the care prevene include the following body temperature, pulse rate, respiratory rate, rate of breathing, and blood pressure. Vital signals are useful in detection or monitor medical problems. Vital signal can be measured in a medical setting and home and the seat of the medical emergency or elsewhere. Blood pressure is the pressure and the blood pushing against the walls of your arteries. Arteries carry blood for your heart to the parts of your body. Your blood pressure normally rises and falls together the day. Temperature is a measure of how wet your body can make and get rid of the hair. Hair rating is the frequency of the reliable measure by the number of conditions of the hair per minute. Respiration rate in human is measured by counting the number of the brighter of 1 minute Togger consider how many hits and the chest rise. Patient care ensure that the patient is kept happy and comfortable with her well-being in mind. It's, it is here read to the writing with digital and care and the with have read be her privacy mining. Acute loss of counselor. A counselor can lose for several seconds to locate present and cause due to shorter of oxygen in the brain, which can happening for a variety. Electrocardiogram. An electrocardiogram records the electrical signals in the heart. It is common and pilot test used to quickly detect heart problem and monitor the heart health. Intravenous. Intravenous maze with a vein. Most offer it referring to give medicals or fluid together are needler or tube inserted into a vein, which allows the medical or fluid or to enter your blood system right now. And normal saline. Fluid therapy is critical component of the clinical manager of patient is conscient of calling happening as well as crystalloid happening. The most commonly used crystalloid work with its normal saline with its user is a management and the therapy of the hydration, hypolemia shock, metabolic alkalosis in the presence of fluid loss and mild sodium depletion. In this case, you can see many of the words to investigation. Patient with pneumonia, class 1, case number 1, cliff compilation core and the fear to 4 days. History. Mr. Alcott is an 18-year-old man with developed a heart productive congestion for days prior to be an physical. The, the sputmont in the thicker and the yellow with a stick of blood. He developed and fever, shaking, chills, and malaise along with the count 1 day and be the development part in his right chest had intensified with inspiration. The patient lost 15 points over the past few moments but claims he did not lose his appetite appetite. I used to get I have the flu. Past history revealer has had chronic smoke through the 10 or 50 years, with the considered as be hit more productive on most over in the early morning. He smoked two packs or cigarettes per day of the past 50 years. The patient is a retired truck driver who has been treated for mild hypertension, bronchitis, a predictive as a young adult, hemorrhoids, and a fractured femur and splenic injury motorcycle accident. Physical examination. The patient is iron and on apparent tear hair and underweight. His complexion is sallow. He home condition similar on a chair. He learned to hit his side, holding his right chest with his left arm. Vital signals are as following: blood pressure 150 to 90 line, a, a, apical hair reaching 100 to 11 minutes, and regular respiration rate to 11 for minutes and something lower. Temperature 102.6 Fahrenheit. Examination of the neck revealed a large amount tender hard limbs, mode in the rings, supraclavicular fossa, but lungs are reasoned be precursor with an exceptional the right mid anterior and the with mid ladder launch. Mid ladder launch. Inspiration crackly are hit and are the right anterior and right mid ladder long field. The remnant of the lung fills in the clear. Percussion and the auscultation of the hair reveal no singular abnormality. Examination of the figura flows work club. Laboratory WDC 70,000 mm3 neutrophils, 70% bands, and 15% lymphocyte, 15% occur of the leaflets following and checks its right PA with and ladder. Which revealed an occult phenomenon in the right meaning love, the patient and treated with antibiotics as an autopayment during the 10 days of treated the patient and favor Haber and the left something living as point treatment follow-up checks right relevant right lies supping cytology demonstrate atopic cell.